Thank you very much, Kate, Lauren, and Lee. For invitation, especially to the People Health Movement from South Africa. It's a pleasure to be here. I will try to go direct to the point, but first, I don't intend to present the long history of Brazil about vaccine production, especially in the Oswaldo Cruz Foundation since the beginning of 20th century in Brazil. So first, I would like to show you this graph. Is something that you already know, but it was in May of this year to show the inequality of the access and the distribution of vaccine in the whole world. So, and actually how high income and upper middle income countries concentrate all the doses of COVID-19 all over the world. So, and this is already know about you. So what is the point? This point is we have to face the immense inequality of vaccine production, especially in the global south. So in Brazil, probably you already know as well, we have been suffering of economic and political crisis since 2013. The economic austerity and the privatization interest is so big, especially in the health field. The politicization of COVID-19 pandemic debate is tragic because, you know, in Brazil, we have a long history of vaccine confidence, and we start to face vaccine hesitancy responses from society. So there is a complete lack of coordination in the federal government. So state and municipalities are responding on it. And what is the point here again is the scientific and research and development institutions, especially the public, like Fiocruz and public university, are responding right now to mitigate COVID-19 impact in Brazil, especially producing vaccine. So I will pull it. So we have since 1973 an important and big national immunization program with a lot of confidence, and we have many problems since 2017 about distribution and what we call vaccine policies, right? There's many aspects on distribution, access, and confidence, and there is a decreasing curve here about, for instance, the triple-viral vaccine in Brazil. So the main important vaccine research and factories in Brazil are Biomanguinhos in Fiocruz and Butantan Institute. Here you can see a list of all the vaccines that we already produce. The point here is we don't create any new vaccine. We receive a technology transfer. So I think that is another point to discuss in the Global South. How to strengthen and innovate to create and have partnerships since the beginning of creation, production, and distribution of vaccines in the Global South. So there are many historical strategies, especially PAHO, WHO, and UNICEF funding since 1970, so that push ahead the Brazilian vaccination production, but mainly the public investment in vaccine in Brazil. So this is a kind of a path dependency that we can see that public sector in Brazil is very strong and sometimes very competitive with private market, right? So also that there's a lot of partnerships on product development, our PDPs. So the intention is to have self-sufficient program in immunologicals since 1985, but this is not achieved until now. So that's it. It is still a big challenge in how to have a science, technology, and innovation. And I think that it's not just a problem in Brazil. The main point is how we can avoid global South competition, because we already have the very competitive arena from global North and global South. And when we are creating and fragmented global policies about vaccines, probably we could promote competition among us. So I'm sorry, I'm running because of the time, but there's a lot of questions to share. So without vaccine, low-income countries increase social, economic, political, and humanitarian crisis, not just for now, but for generations. Now we can see the vaccination of children in the global north, and in Brazil, especially, we are stopped about COVID-19. In Brazil, more than 600,000 families have lost their relatives. In an equal country, deaths can devastate social groups as indigenous people and improve gender issues. Health system and social security are collapsing right now. And when international public health emergency of international concern is over, there's no interest anymore to invest in the global south. For instance, during Zika outbreak in Brazil, when WHO declares the end of public health international emergency, the funding and response to the Zika outbreak stop completely. We don't have investments to produce a vaccine right now. Fiocruz is continuing to invest in a vaccine to dengue and the 4 serotypes of dengue, and also Zika as well at the moment. But the funding, it's not enough. So, and Brazil has a very strong scientific and industrial structure for health, producing excellent research, medicines, and biopharmaceuticals to provide to our national health system for public with no profit interests. So now, when we have the running to COVID-19, we have a kind of a struggle of public interests and privatization in Brazil. For instance, right now, Oxford launched probably a new clinical unity in Brazil related to private sector to develop clinical trials on vaccine and pharmaceuticals as well, without Fiocruz or any public institution partnership. So I think that it's also a big threat. Inequities in global health policies and the fragile health diplomacy has been difficulted the access to health supplies and technology to access vaccines, biopharmaceutical masks, medical ventilations in low-income countries, as you all already know. So emergencies and re-emergencies in global health has to be completely redesigned to develop and improve global South sustainability and international cooperation to prepare and respond to health and humanitarian issues. So that's it. I would like to discuss a bit more in the Q&A session. Thank you very much.